We've brought this into being through a patient narrative, focusing on Jack and Eileen, their family, their children, their grandchildren, their great-grandson. And really by doing that, we're focusing much more on outcomes. We feel the case for this needs to be around what will those outcomes be around the quality of care and the experience that people have when they use health and social care services. Part of that is by developing I statements, the statement that says that, for example, I will be able to live my life rather than just get a set of services. I think the main barriers around integrated care have been the transition across the health service. It's been a distraction in one sense. It's enabled us in other ways in helping us focus on the structures and what we want and actually what we find isn't particularly helpful in the health service. But just having to go through that has been a distraction. The big enablers for integrated care in Solihull have been bringing on board the patients, most of all, ensuring that we've focused on their outcomes, being very clear that the strategy at its highest level is about the outcomes for patients, the quality of care, improving that quality of care and improving that experience. And to do that, we have brought patients on board. We've made sure that we have linked very clearly with the local politicians, the local councillors, the local MPs, ensured we've had that discussion. The other enablers, much more on a health service basis, have been bringing on board the major organisations, the Heart of England Foundation Trust as our large acute provider, the Birmingham and Solihull Mental Health Foundation Trust as the big provider of mental health services, the CCG and all the GPs. We have two localities in Solihull, so the north and south GP localities, bringing on them. That sort of full engagement has really enabled this to go forward. The measurement of success will ultimately be in whether Jack and Eileen get a better experience and get the high quality care. Ultimately, that outcome has got to be measured in terms of those I statements and the responses we get to those. But I think there's also something around the structure and process of how we integrate care, ensuring that the organisations at very high level, chief executive level, are coming to regular meetings and discussing how we enable this to go forward, but also truly tackle the barriers. I think there's something around the engagement of the workforce, ensuring that we're upskilling the workforce to understand the real principles about integrated care. This is a mind shift change. There is a significant cultural and attitudinal change that frontline workers are going to have to buy into if this is going to be a success. The other success measure will be how we communicate this with the public. There's something around the public believe in the traditional ways of delivering healthcare services, that hospitals are best. And I think that the Mid-Stats Review, the KIO Review, are very much showing that that may not always be the case, and that we've got to offer a much better and credible alternative around quality of care and patient experience. And to do that, we have to communicate that well. We have to be able to tell the story of Jack and Eileen in such a way that it makes sense to them, that they understand what it is we're trying to do, and therefore they buy into it. And it comes back to that thing I started with around the fact that it is by engaging with the public, defining this in terms of their statements, the I statement, I will get more services provided high quality locally, something that really makes sense to the people who will be experiencing these services. Part of the realisation is that whilst we want to deliver at scale and pace, and that has to be our objective, there just isn't enough time not to do that in one sense. The converse of that is that actually if we do this hastily, if we do this too quickly, then I don't think this will embed. I think the lessons that we've learned from elsewhere, nationally and abroad, have been that you have to take time over this. Many organisations have spent decades developing integrated care, so we've got to be careful that we don't rush. So my three top tips would be: get top leadership engagement. The chief executives of the foundation trusts, the Health Watch, Health and Wellbeing Board, politicians, local leaders, GP leaders. Get them on board early on and keep them on board. The second one would be focus on the patient, the citizens' outcomes. Ensure that they are fully engaged. We have a citizens' assembly being brought together around integrated care, and so we want people to really be engaged so that mandate is there, that people really see what is possible. And I think my third one would be absolutely clear on the case for change. And I find myself stating it again and again and again. And actually, I don't think I should apologise for that. I think we have to keep reminding people that there are very good reasons why we should move to integrated care, that the public need us as leaders to state that case for change and stick to it, not to give up. Because what has gone on in the past is just not sustainable. We can't keep on having the winters that we have and all the pressures that we have on us. We can't have the quality or the poor quality of experience that was shown in mid-stats things. We have to improve that patient experience. So ultimately, stick to the message, believe in the message and stick to it.